Hi.
Summertime is almost here, and that means more picnics, barbecues, and food festivals. But food left sitting outside can sometimes lead to food poisoning, a risk factor for a serious medical condition known as irritable bowel syndrome. There's a new development surrounding that disease now, and Dr. Ali Rezai of Cedar Sinai Medical Center joins us from Washington, D.C. with more details. Good morning, doctor. Thank you for joining me today.
Hello. Thanks for having me.
Now, doctor, why does food poisoning put you at risk for more serious health problems?
So when you have a food poisoning, the bacteria go through your body and they have a lot of toxins, and sometimes your body reacts to those toxins. Irritable bowel syndrome, or IBS, is a chronic common condition inflicting more than 40 million Americans with debilitating symptoms. And food poisoning with all those toxins and the antibodies that you produce against it can cause irritable bowel syndrome and decades of symptoms. Now we can check these antibodies that helps us diagnose this disease.
Oh, wow. Now, please share with us also, how will a person know whether their stomach issue is minor or something more serious that needs medical attention?
So usually when you have symptoms that you seek medical help, as they are non-specific, such as change in bowel habits, abdominal pain, and bloating, you go to your doctor and they run multitude of tests, such as endoscopies, colonoscopies, abdominal imaging, stool tests, blood tests, and if they can't find anything, any organic cause, usually you're considered to have irritable bowel syndrome or IBS. And this process can take several years. So fortunately, right now that we can detect all these antibodies in your blood, then you can skip all those steps and know your diagnosis within 24 hours or several days that you do the blood test, so you can go on and treat it appropriately.
That's definitely a big change. Now, please tell us more about this significant development surrounding IBS recently. Give us just a little more details about that and how the process works.
So we validated this test on more than 2,500 IBS patients and controls, including patients with inflammatory bowel disease, celiac disease, and healthy controls in over 180 centers in North America. What we found is that IBS patients have antibodies towards toxins of bacteria that can cause irritable bowel syndrome and also can be used to diagnose this disease. And this test has specificity or accuracy of more than 90%, so reliably and accurately can diagnose your disease.
Okay, that is great. Now, lastly, doctor, what are some resources available to help people with IBS or people who are unsure whether they have IBS and give them the right way to go?
So you can go on ibscheck.com, which is spelled as IBSCHEK, and there are information about irritable bowel syndrome, how this test works, and also a recent peer-reviewed journal article that we published at PLOS 1 journal. You can access all of those and how you can order this test as well.
Okay, great. And remember, with all of the food outings and festival happenings this summer, you want to make guarding your stomach health a top priority. Be sure to visit www.ibscheck.com for more information and tips on staying healthy this summer. Thank you so much again for joining me, doctor.
Thanks for having me. Bye-bye.